very good evening. From stories around the world to stories here at home, this is the National News broadcast. I'm Vidushni Sadish Kumar.
A very good evening indeed. I'm Charita Rupavahini, and now let's move on to the headlines for tonight's news.
Research says that the currently spreading type of virus has a higher tendency to propagate. Further operations in search of those who left the western province to other provinces in the past 2 days. A food bag valued at 10,000 rupees to families undergoing quarantine. Construction of the Nelluva-Lankagama road is scheduled to end by first week of next month.
On to those and other stories in detail now, and starting off with local stories. It has been established through research conducted by a team of researchers at the University of Sri Javardhanapura that the coronavirus type currently being spread has an extremely high speed spreading capability. They also have pointed out that currently type is totally different from the type which was reported in the country previously. According to the tests conducted, the virus species could spread from person to person within a relatively short period. The virus load infected to the first recipient could be numerically higher. The same type of virus is seen in the Bidawangkoda Brandix cluster, Paligoda fish market, and circulated in the Colombo city. The research has established that the new virus belongs to the B142 subgroup and resembles the SARS virus. Head of the research team, Professor Dileka Malavige, says further tests have been conducted to find out any resemblance of the existing virus to the virus type presently being spread in other countries. She added that research is being conducted through funds of the World Health Organization and sponsorship of the Ministry of Health. Dr. Chandima Jivandra, expressing his views on the test, said that bone samples were obtained from several centres connected to the Brandix Institute cluster in Bidawangkoda. He also said that they have also attempted to sequence structures from the samples obtained from the fish market and also from the Colombo Municipal Council limits. Dr. Jivandra further said that they have detected only one type of virus in all the 13 groups detected from several locations, which they said belong to AB 152 category. He further said that the demonstration they have marked in blue the two types of virus identified in Sri Lanka previously. The red color denotes the presently identified type. However, the new type is differently from the previous type. The type of virus existing in Sri Lanka at present is similar to the one reported in countries such as Sweden and Denmark. It has rapidly expanded in European countries recently. Dr. Jivandra also said that 15 of the 16 they have sequenced, there was a special mutation which they have identified at D614G mutation. The significant aspect of this mutation is that presence leads to a higher viral load, which means that there is a higher propensity for person-to-person transmission.
කන්දකාඩුවකෙත් ඒ ක්ලස්ටර් එක ඇතුලේ ඔක්කොම එක සමානයි. හැබැයි උනාට මේ සැරේකට වඩා වෙනස්කමක් තියෙනවා. දැන් මේ වෛරස් එක දැනට වාර්තා වෙලා තින්නේ ස්වීඩනයේ ඩෙන්මාර්කයේ වැනි යුරෝපීය රටවල. ඒ වගේ රටවල ඉතාමත්ම තදින් ව්‍යාප්ත වෙන වෛරස් එකක්. මේ අපි සීක්වන්ස් කරපු 16න් 15කම විශේෂ මියුටේෂන් එකක් තිබ්බා. ඒකට අපි කියනවා D614G mutation එක. ඉතින් මේ මියුටේෂන් එකේ තියෙන වැදගත්කම තමයි මේ මියුටේෂන් එක තියෙනකොට ඒක ගොක් වෙලාවට වෛරල් ලෝඩ් එක, කියන්නේ වෛරස් ප්‍රමාණය වැඩි වීමට හේතුවක් වෙනවා. ඊට අමතරව යම්කිසි පුද්ගලයෙක්ගෙන් තව පුද්ගලයෙකුට ට්‍රාන්ස්මිසිබිලිටි එක වැඩි මේ මියුටේෂන් එකේ තියෙන වෛරස් එක.
Health Minister Pavitra Vanniyarachchi said that research report on the new virus group was received by the Health Ministry today. Minister Pavitra Vanniyarachchi said that a significant change in the behavior of the virus has been observed this time. Accordingly, the President has instructed to conduct a study on the nature of the COVID-19 virus present in Sri Lanka. As a result, a group headed by Professor Dileka Malavige have conducted an in-depth study in the laboratories regarding the existing viral type. According to their report received by the Ministry of Health, there is only one type of COVID-19 virus prevails over the island. It was seen in Bidawangkoda, Berwala and other areas. Minister Pavitra Vanniyarachchi also said that they have continuously taking all measures to control the spread of the virus in the country. The minister has expressed hope that the general public would extend support in this regard by adhering to health practices correctly.
The Irida Aibowan live program of the Sri Lanka Rupavahini Corporation, to be telecast from 8:30 am to 9:30 am tomorrow, will discuss on the current situation of the COVID-19 pandemic. It will be conducted with the participation of Secretary to the Ministry of Health, Specialist Physician Major General Dr. Sanjeev Munasinghe, Director General of Health Services Dr. Asela Gunawardana, Specialist Physician of the Epidemiology Unit Dr. Samitha Ginige and Professor Neelika Malavige of the University of Sri Jayawardenepura.
And meanwhile, the Department of Government Information says that numerous groups are engaged in socializing false information regarding to the department in order to fulfill petty objectives. The department in a communication today says that relevant, essential and daily duties are being carried out without any obstruction. The Government Information Department says one of its employees had become a corona-infected person as a result of visiting the Paliagoda fish market recently. It further stated that as a result, the employees and his associates were directed for quarantine. The communique adds that necessary services are being provided according to protective health guidelines by utilizing minimum number of staff. Media personnel constantly arrive at the department. However, taking into consideration of their safety, media briefings were conducted without the attendance of media personnel. The Department of Government Information further says that it has the ability to fulfill accomplished services using the maximum extent of latest technological methodologies and facilities.
Meanwhile, the police was able to detect 454 persons who have gone to other provinces from the Western Province on the 29th and 30th of this month, contravening quarantine laws. Police media spokesman DIG Ajit Rohan said that in a media briefing this afternoon that these persons were subjected to self-quarantine in their places of stay. 5 persons who were hiding in their houses in Hatton, Dikoya, Norwood and Kotagala after engaging in services in Vellavatta and Mattakulya in the Western Province were directed to self-quarantine. Public Health Inspector of the Dikoya Urban Council, RRS Madavala, said that members of their families have also been quarantined. The Acting Inspector General of Police has issued a special circular to the senior DIGs officials in charge of divisions, senior officials in charge of districts and officers in charge of police stations. The circular related to granting of permission to employees in 84 institutions, including ministries, departments, corporations, boards, authorities and media, to use the official identity card as curfew permits. A quarantine curfew is presently being implemented in 117 police divisions. They include 112 police divisions in the Western Province and 5 police divisions in the Kuliyapitiya division. The police engaged in search operations in all round roads, including highways, using road barriers. 1,451 persons who have violated the quarantine curfew have been arrested. Out of this number, 221 were arrested yesterday. 40 vehicles were also taken into police custody yesterday. District COVID-19 Control Committee has decided to close down all holiday resorts and lodgings in the Kegalle district. The decision was taken at a meeting presided over Sabaragama Provincial Governor Tikiriko Bakaduwa. Distribution of short-eats parcels to police officials engaged in road checkpoints established Colombo took place today on the instructions of Senior DIG in charge of Western Province, Deshabandhu Tennakon. Army Commander Lieutenant General Shavendra Silva says that the decision regarding removing curfew in the Western Province will be taken upon evaluation of reports received today and tomorrow.
And here's the local update of the COVID-19 pandemic. The number of patients fully cured from the COVID-19 disease has increased to 4,399. 117 recovered patients have left hospitals today. 137 COVID-19 patients were identified in Sri Lanka today. 99 out of them were close associates of Paliagoda and Fisheries Harbours. The remaining 38 patients were undergoing quarantine in quarantine centres. The percentage of fully cured COVID-19 patients numbering 4,399 is 41.65%. 6,442 patients are continuously receiving treatments as a percentage that is 58.15. The highest number of PCR tests conducted in a single day, numbering 12,106, was recorded yesterday. The total number of PCR tests conducted amounted to 502,669. The 20th COVID-related death in the island was reported yesterday. The victim was a 54-year-old woman undergoing treatment at the Colombo National Hospital. She has been identified as a COVID-19 infected patient by the PCR reports received today. The epidemiology unit says that the woman was admitted to the hospital on the 29th of this month, was suffering from inherent diseases. She was a resident of Colombo 12. Funeral took place at the General Cemetery, Barella today. As of today, 56 officials assigned to police stations in the Western Province are afflicted with the COVID-19 disease. They include 6 officials of the Berala Police Station, 917 police officials undergoing quarantine. 162 officials have been directed to quarantine centres. And Chief Epidemiologist Dr. Sudat Samaravira told the media today that a new COVID-19 testing method will be introduced to the Sri Lankans to replace PCR test, and he said that the new method was approved by the World Health Organization.
We are continually doing the PCR testing and sampling and the PCR testing to identify more cases among the close contacts. And that PCR testing is something that take time and also expensive, so that expanding the PCR testing rapidly is impossible. In this context, the World Health Organization has recommended antigen rapid test for detection of COVID-19, and now we are validating that test in country, and we hope that very soon we will be able to utilize that test for screening of our people for COVID-19. This is a cheaper test and also very rapid. It need not laboratory facilities to do the testing. You can do it in the community where the patient people are, and also it gives very rapid results. So because of that, we think that this is a very good substitute for the PCR testing to detect cases, and we will be able to detect more and more cases very rapidly. That will enable us to isolate them from the other people, so that it will prevent further spreading, and also that we will be able to identify most of the cases among the first contacts with this test.
Well, a program to provide free of charge a bag of food valued at 10,000 rupees to families undergoing quarantine is being implemented. The district secretaries are implementing the program, which fulfills food requirements of the families for 14 days. This was disclosed at a discussion at the President's office, presided over by Chairman of the National Task Force on Economic Revival and Eliminate of Poverty, Basil Rajapaksa. The program is being implemented under the instructions of the President and the Prime Minister. It is being conducted through 2 stages. Accordingly, bags of fruits and dried food are being provided to 6,025 families undergoing quarantine in 13 divisional secretariat divisions in the Colombo district. Food bags were handed over to families undergoing quarantine in Gunasiripura district. Secretary Colombo Pradeep Yasaratna says similar programs are being implemented in the divisional secretariat divisions of Homagama, Dehiwala, Moratua and Kaduwala. Bags of food are scheduled to be handed over to 6,807 quarantined families in 13 divisional secretariat divisions in the Gampha district with effect from next Monday. In the Kaltur district, 2,245 families are undergoing quarantine in 14 divisional secretariat divisions. A further 1,248 families are being quarantined in the Kegal district. These families will also receive their food requirements.
And meanwhile, the Family Health Bureau says that all government hospitals have been given instructions to extend 24-hour treatment facilities to mothers confronted with illnesses. Mothers who are having symptoms such as fever, cough, breathing difficulties, bleeding or dischargings in the vaginal tract, fainting, epilepsy, severe stomach aches, body swelling, strong headaches or any other dangerous characteristics should immediately report to the nearest government hospital. A communique issued by the Bureau further says that maternity record book could be used as a curfew permit. In the event of any threatening situation, the Family Health Services officials could be contracted. They could also call the Family Health Bureau via telephone numbers 1999. The Swasari ambulance service could be obtained through the telephone numbers 1990.
Prime Minister Mahinda Rajapaksa requests the Mahasangha to chant the Ratana Sutra in all Viharasthanas in the island to extend blessings to the country in the face of the COVID-19 pandemic. A communique issued by the Prime Minister's office says that the entire world, including Sri Lanka, is confronting a chaotic situation due to the emergence of the COVID-19 pandemic. The message therefore points out that it is more appropriate to chant the Ratana Sutra, extending blessings to the entire world community.
The Army Engineering Task Force says that construction in the Nelluva-Lankagama road could be completed by the first week of next month. The work in the roadway is in the final stages. It has commenced to fulfill a long-standing public need. President Gotabaya Rajapaksa, who was engaged in an inspection tour of Lankagama on the 29th of August this year, has instructed the relevant sections to complete construction within 90 days without causing any harm to the environment. The Army Engineering Corps has commenced construction of the road on the 2nd of September with the approval of the National Building Research Organisation. Under the first stage of construction of a distance of 6.5 kilometers from Nelluva Varukandeniya to Lankagama has been developed. 1 kilometer of the portion of the roadway is to be paved with concrete. 34 bridge culverts have been erected. The Road Development Authority has completed 4 kilometers of the road. Under the second stage, 5.4 kilometers of roadway from Dombagoda Lankagama to Deniyaya is being constructed. Work in 1.8 kilometers of the part of the road has been completed. The part of the road consisted of 52 culverts. Work on 14 of them has been completed. The construction process is being carried out in an extremely environmentally friendly manner without using explosives to break boulders. Upon completion of the project, it would shorten duration to travel from Nelluva to Deniyaya to 45 minutes from the current duration of nearly 4 hours. The President has also promised to erect a concrete bridge in place of wire bridge which was destroyed by floods. The Sri Lanka Telecom and the Mobitel Institutes are providing communication facilities to the President through a service supply project. A building comprising of smart classrooms have been constructed to the Lankagama Junior School. The facility enables students to have e-learning services in face of the COVID-19 pandemic. The residents in the area have extended their gratitude to the President to come forward to resolve many problems in the Lankagama village. They have especially conveyed their thanks for taking time to safeguard the Singharaja Protectorate and the construction of Nelluva-Lankagama Road.
State Minister of Batik, Handlooms and Local Garment Manufacturing, Dayasiri Jayasekara, says that his ministry is prepared to produce locally national and Buddhist flags needed by the country. The minister has made these remarks when he met President Gotabaya Rajapaksa. The meeting has taken place at the President's house last evening. Sri Lanka annually spends a large sum of foreign exchange to import national flags and Buddhist flags. The aim of the government is to produce flags of high standard from next year. A national flag made through batik designing was presented to the President on this occasion.
Inquiry of public evidence of the Presidential Commission investigation on political victimization has been concluded. The report in this connection is scheduled to be handed over to President Gotabaya Rajapaksa on or before the 19th of next month. The Commission has been entrusted with the task of investigating charges on political revenge on government and semi-government employees from the 8th of January 2015 to 16th of November 2019. President Gotabaya Rajapaksa has set up the committee through an extraordinary gazette notification number 2157/44 dated 9th January 2020. Inquiry on public evidence of the Commission had commenced on the 16th of January 2020. In term was scheduled to be expired on the 9th of November. However, examination of public evidence was terminated on the 29th of this month. The Commission has received 1,842 complaints during this period. 112 complaints were examined. The remaining 872 complaints have been forwarded to the Ministerial Committee investigating political victimization. The President Committee probing political revenge was handed over by former Supreme Court Judge Upali Aberatna, and the other members were former Supreme Court Judge Chandra Jayadilaka and former GP Chandra Fernando. And with that, we conclude tonight news. Do it just tomorrow at the very same time. Stay safe. Good night.
Good night.